very, very important for people to remember what the measures to restrict the transmission of COVID were trying to do. We had, at the peak of the pandemic, we had about 40,000 people or more in NHS beds. The NHS has a total of about 100,000 beds. And we knew that if you had another 20,000, 30,000 more, and it could easily have happened mathematically in the NHS, the system would have been overwhelmed. And what would have happened then is that all those cases that you've just mentioned, all those people who didn't get the help that they wanted with their cardiac concerns, with their cancer diagnosis, all those other health conditions that you've just described, they would have been pushed out even further to the right. And the people would have got, the NHS would have been in an even worse position now to deliver the help that's required. So what the government is doing instead is mounting a massive campaign to cut the COVID backlogs. We're putting in all the 100 community diagnostic hubs. We're investing hugely in the NHS now to help people get the treatment that they need. I appreciate that delays in A&E are very severe, and the ambulances are backing up, but that's why we're funding the reforms of social care. And that's why we're trying to help people get out of the acute sector and into the place where they can be treated better. But I just come back to, I think there's a sort of inversion of logic going on. People are now saying too much lockdown caused the current problems in the NHS. I'm afraid to say that the opposite is the case, in the sense that if we hadn't locked down, if we hadn't tried to prevent the spread of disease, then the problems we're facing now in the NHS would be even worse. And I really urge people just to think about the logic of what they're saying.